Okay, so this is just a really quick video today, and I wanted to talk about this concept of soft phrasing. Okay, I call it soft phrasing, and it's linked to the communication style in the UK, and it's this understanding this is probably one of the things that makes the biggest difference for international doctors, international nurses, and other health professionals that move from other cultures and come and work in the UK. If you don't understand how important this is, you can come into a lot of problems. You can come across as rude, and it can really cause a very big barrier to your relationships and how you're seen as part of the team. Now, the way that I want to kind of explain this, right, is think about fabric conditioner. If you use fabric conditioner when you wash your clothes, okay, it makes your clothes really soft, really fluffy, really cuddly, okay? Now, when I talk about soft phrasing, it's kind of like the fabric conditioner for our words, for our communication. It makes it more cuddly, it makes it more fluffy, okay? It makes it less kind of harsh and direct. So when I say soft phrasing, I mean the fabric conditioner for our words. Now, in the UK, people are generally very polite and very sensitive, okay? And when we're speaking, we never want to offend, or we don't want people to feel like they're forced to do what we're asking them to do. So when we're giving an instruction, we use these soft phrases to make it a bit more cuddly and fluffy and friendly, and to give them an option to say no. So we say things like, you know, would it be okay if you, or sorry to bother you, but I was just wondering if, or would it be possible, or, you know, but don't worry, you know, if it's not possible. You might well have heard these kind of expressions that are used. You know, whenever I text a friend for a favour, you know, I'll always say, I was just wondering, and then I'll ask maybe the favour, and I'll say, but no worries if not, it's not a problem. And I'll always end it like that because I don't want them to feel under pressure, okay? And it's the style of how we communicate in the UK. Now, the problem is that a lot of international doctors and nurses and other health professionals come from cultures where you don't need this fabric conditioner for your words, okay? You don't need this soft phrasing, because it's completely acceptable and it's very valued to say, just come out and say what you want, come out and say what you think, and to do it in a very direct way. And in that culture, in those cultures, that's valued. That's how you communicate. It's not interpreted as rude. People aren't offended by it. You know, it's valued, okay? This directness. The problem is that it's just not valued the same way in British culture. So we have to kind of fluff up our language to be accepted and to not come across as rude. So one of the biggest problems, I think, that a lot of international doctors have had that I've worked with, and they're told you need to improve your communication, you know, or the colleagues are saying, you know, you don't communicate well, or people are saying that you're rude. It's this misunderstanding of communication style. So when you're giving an instruction to a colleague or a patient, just use some of this soft phrasing. Would it be okay? Or could you just lift your arm up? Or would it be okay if I just listen to your chest? Or I'm sorry to have to do this, but I just need to, you know, I just need to put this cold gel on you. Or when it's your colleagues, you know, would it be okay if you just, you know, took his obs maybe 4 hourly? So we're giving the same instructions, we're giving the same directions, but we're pouring in that fabric softener for our words. And that will make your communication style fit in a lot better. You'll find you'll have less difficulties. You'll find that people relate to you better, and that you're not coming across unintentionally as rude. So I hope that's helpful. Think about that fabric softener. Think about how you give directions and instructions, and maybe adjust your communication style a bit better to what is valued in Britain, and you might find things a bit easier. So I hope that's helpful.